Okay. Hi, my name is Ashley. I oversee the sterile preparation of IV medication at the hospital. And today, we wanted to show you just how many steps are involved in preparing a chemotherapy drug for a patient. The very first step is to recognize that chemotherapy wouldn't reach our patients without many key players and their coordination and cooperation. Specially trained pharmacy technicians review usage information for all the chemotherapy drugs that are used in the hospital. These pharmacy technicians ensure that regularly used medications, such as cyclophosphamide, which we are going to track today, are always in stock at the hospital. Once a chemotherapy drug arrives at the hospital, it is transported to our hazardous drug storage area in a special hard plastic container. Hard plastic containers, which protect drugs from light, are used to store chemotherapy medications safely in our pharmacy. After a patient is assessed, healthcare providers create a treatment plan. Any medication order, including orders for chemotherapy, are entered into the hospital information system, EPIC. After being entered into the system, the order is reviewed by a pharmacist. Pharmacists review all the clinical information about the patient and the chemotherapy that is ordered to ensure that it is clinically appropriate. In this video, we are focusing on only one chemotherapy dose. However, a single patient's treatment plan can contain more than 20 to 30 different medications, both chemotherapy and supportive medication. All of these need to be reviewed by the pharmacist. Once a pharmacist has reviewed the chemotherapy order, the order is then verified. Due to the complexity of chemotherapy medications, these orders require a second verification performed by a different pharmacist.
Okay, second's done.
Once the second verification is complete, the order is sent via EPIC to an IV workflow system, which guides and documents the preparation of IV medications in pharmacy. A pharmacy technician sees the order in the setup queue and begins setting up the medication for preparation.
I look at my supplies list, accepted my barcodes in the system, saying that everything that I scan matches everything that the computer's expecting, and it will generate the parts list and we'll have it ready for preparation.
Cyclophosphamide is placed in a tray with supplies for preparation, then placed in the pass-through. The drug is removed from the pass-through and brought to a biological safety cabinet to prepare the chemotherapy. Chemotherapy is prepared and administered using special safety devices called closed system devices, or CSTDs. The pharmacy technician is guided by the IV workflow system on how to prepare the chemotherapy. The system not only utilizes volumetric images, but also weight-based calculations via a scale to ensure that the dose is prepared accurately. Cyclophosphamide is required to be reconstituted before it is further diluted during preparation.
End to end, it could probably take about 25 to 30 minutes to prepare cyclophosphamide. We prepare 70 to 90 different chemotherapies in a day, so everything is very specifically timed based on the administration time to the patient.
Once the technician accurately prepares the dose, a label for the product is generated from the system. Once the medication is prepared, a pharmacy technician does a final physical inspection of the product, attaches any required labeling, and packages the product for dispensing to the nursing unit. Simultaneously, a pharmacist reviews the preparation of the chemotherapy remotely using the IV workflow system, checking that each step was performed correctly. When all of the final checks of the chemotherapy have been completed, a message is sent to the pharmacy technicians that the chemotherapy is ready for delivery. A pharmacy technician places chemotherapy in a hard plastic container for transport to the nursing unit for administration. For a single patient to receive even just one dose of chemotherapy, many teams and systems must work in unison with one another. The safety and efficacy of this complex process would not be possible without incredible cooperation across disciplines and departments.